dry shield. So when you autoclave these, we roll them up and roll it in a paper towel so that it'll fit in this size bag for sterilization. This end is going to go into your high suction, and this end is going to attach to the mouthpiece. Usually in Eastburn, we have the high suction down here for nitrous or the dry shield, and we hook it there. One of the things you can do to help is wet this down and wet this side down before you try to attach them. They're gonna slide on a lot easier. Zoom into this part. So one of the things you wanna check before you put it in the patient's mouth is there's a little piece of rubber here that needs to be placed in and pushed in to lock. If this isn't attached, air and liquids will kind of leak out and you won't have as strong of a suction. So then once you've moistened it, all you need to do is push it down and then make sure, again, this piece is engaged and this is all the way up. I have Danny here who's gonna be our patient. She's gonna demonstrate how we place the IsoDry-In. So I'm gonna isolate like I'm working on her left side. When you're practicing, it's usually a little bit easier if you start on the side that you're sitting because you can see a little better. First trick is you do not want to turn on the suction yet. You want to wait till the very end once you have it comfortable in the patient's mouth before turning on the suction. So it is a big piece. You want to fold it in half like a hamburger, and then you're gonna line this part up just like a normal bite block. So I'm gonna have Danny open really big, and then I'm gonna line those grooves up with her teeth. And then Danny, go ahead and bite on that gently for me. Once I have Danny biting, then I'm gonna sneak this around. Danny, go ahead and breathe through your nose. This is a little bit of a mouthful, but once it's in there, it should be pretty comfortable. So now that I have it seated, I make sure this is all the way here, her tongue is underneath, and there should be a decent seal or close to along her palate. So you can keep a bite on this. As if there's a lot of water, if you squeeze that little bite pillow, that's gonna help clear the water. And I'm gonna turn it on. It can be really loud, so a lot of the times if you're using suction or say you're going to do a pat cord with a crown and you don't need it on all the way, we'll turn it down halfway. If you're a hygienist and you're working by yourself, you can also use the high suction. So say I had my ultrasonic, I can use my high suction to retract her teeth and also ultrasonic. You can do the same thing with the small suction. And I'll go there. I turn it off first and I let the patient know that I know it's really dry in there, hang in with me, I'm gonna give you a really good rinse once I get it out of there. So I turned it off, same thing, it's a little easier to take it out. I set it down, and then I'm gonna give her a good rinse. Some tricks that I use, I always introduce it to the patient if they are unfamiliar with it as really cool technology. So something I'd say to Danny would be, we're gonna use a cool isolation system today. It's really cool technology. It basically holds your tongue back, it suctions for you, it keeps everything nice and dry and isolated, keeps aerosols down. Also, it's really beneficial because it keeps your germs away from where we're working, so your fillings last a lot longer. If you pose it like that, 99% of people are great, awesome. And especially in the COVID time, they're gonna be like, oh, that's great, less aerosols. Multiple people have said that to me this week. If you know your patient's a gagger, one of the things you really want to do is coach them through the seating process. So I would let Danny know, it's a little bit of a mouthful and I know it's new, so just hang in there with me. Most people find it really comfortable once it's in there, but it can be a little awkward to get it seated the first time. So never try to place it in with this full piece. Extended, you always want to bend it to the shortest side. And then having her breathe through her nose, getting through that trouble shot when we're kind of trying to get it seated is going to help a lot. So if Danny was a gagger, I'd be extra careful to bend it, make sure I have it seated, and then bite for me. Sometimes people won't bite enough and it'll be moving, so sometimes you have to coach them a little bit. And then breathe through your nose. You're doing awesome. Making sure you're keeping it forward as much as you can. And then once you have it in, open again for me and bite. You can get it seated really well. And then I'm like, are you okay? Great, turn it on, keep going. I also let patients know that most people find it really comfortable. Some people, it doesn't work for them. And if it doesn't work for you, we're gonna find something else that works. So don't worry about it. That way they have control. It's not for everyone. There's about probably less than 5% of people who can't tolerate it. I also let them know, I'm gonna give you lots of breaks. It's a little harder to talk with this in, so if you raise your hand or make a noise, I'll stop immediately and take it out. Another thing that I mentioned earlier was just when you take it out, kind of preemptively tell them, I'm gonna give you a really good rinse after, because they're gonna have a combination of being really dry and then have a little bit of gunk back by their throat, and that'll kind of prepare them so they know that that's coming.